Welcome to EduCare's mini-module on insulin administration. My name is Jean Howell. I'm an RN with more than 35 years' experience in various healthcare settings, assisted living, home care, case management services, and clinics. My goal in this module is to teach you the principles of insulin and its administration via a subcutaneous injection. The objectives for this mini-module will be to name the 5 types of insulin. Second, describe sliding scale insulin administration. Number 3, identify proper injection sites for insulin administration. And 4, demonstrate proper technique for insulin injections. Why do some people need insulin and others do not? First, we should take a look at type 1 diabetes, otherwise known as juvenile diabetes. The body's immune system destroys insulin-producing cells in the pancreas, and your body does not make insulin. Type 1 diabetes occurs in childhood and must be managed throughout a person's life. Type 2 diabetes is the most common form of diabetes. It accounts for 90 to 95% of people with diabetes. With type 2, the body is resistant to the effects of insulin, which is the hormone produced in the pancreas that regulates the absorption of sugar into the cells. Or the body produces some, but not enough insulin to maintain a normal glucose level. Researchers don't fully understand why some people develop type 2 diabetes and others do not. It is clear that certain factors seem to increase the risk for developing type 2 diabetes. Foods high in sugar, being overweight, lack of exercise, and family history of diabetes contribute to the likelihood of diabetes. Another risk factor is a condition called prediabetes. This is a condition in which your blood sugar level is higher than normal, but not high enough to be classified as type 2 diabetes. Left untreated, prediabetes often progresses to type 2 diabetes. Prediabetes can often be managed by oral medications designed to reduce the amount of glucose in the body. An example is metformin. The trade name is Glucophage. Over time, having too much glucose in your blood can cause serious problems. It can damage your eyes, kidneys, and nerves. It can cause heart disease, stroke, and even the need to remove a limb. Pregnant women can also get diabetes, and this is called gestational diabetes. Insulin is a hormone secreted by an area of the pancreas. Insulin is expressed in units, not milliliters or minims. Insulin used to be made from pork and beef pancreas, but today it is manufactured synthetically. Insulin is not a cure for diabetes, and it is not necessary in every case of diabetes. Insulin is injected. It is not active taken orally. There is no average dose. Each case is cared for individually depending on the insulin needs. The FDA requires all insulin preparations to have instructions to say, keep in a cool place and avoid freezing. Insulin preparations are divided into categories according to how quickly they act, their potency, and duration following subcutaneous administration. The 5 most common types of insulin are rapid-acting, short-acting, intermediate-acting, long-acting, and premixed. First, we'll take a look at rapid-acting insulin. This insulin covers insulin needs for meals eaten at the same time as the injection. Many times it is used with a longer-acting insulin. Onset is usually within 15 to 30 minutes. Peak time, which is the time that it is most effective, is 30 to 90 minutes after injection, and the effects last around 3 to 5 hours. Some common brands are Humalog or Lispro and Novolog or Aspart. Next is short-acting insulin. Short-acting insulin covers insulin needs for meals eaten within 30 to 60 minutes after an injection. The onset usually occurs within 30 minutes to 1 hour. Peak time is 2 to 5 hours after injecting, and the effects last around 5 to 8 hours. Some common name brands are Regular, R, Humulin, and Novolin. Velocillin is a type of insulin used in the insulin pump. Intermediate acting covers the needs for about half the day or overnight. It is often combined with rapid or short-acting insulin. Onset is usually within 1 to 2.5 hours after injection, peaking around 3 to 10 hours, with the effects lasting anywhere from 18 to 24 hours. Common types are NPH and Lenti. This type of insulin is often combined when needed with rapid or short-acting insulin. Onset is usually within 2 hours after injection, with the peak time occurring anywhere from 6 to 20 hours. Lantus delivers a steady level and therefore does not have a peak time. Long-acting insulin can last up to 24 hours. Some common types of long-acting insulin are Lantus and Levemir. These products are generally taken 2 or 3 times a day before mealtime. Pre-mixed insulins are a combination of specific proportions of intermediate-acting and short-acting insulin in one bottle or insulin pen. The numbers following the brand name indicate the percentage of each type of insulin. Onset generally occurs within 30 minutes of injection, with a peak time occurring between 2 and 5 hours. Effects can last up to 24 hours, depending on the type. Some common types are Humulin 70/30, Novolin 70/30, Novolog 70/30, Humulin 50/50, or the Humalog mix of 75/25. Some clients may have something called sliding scale insulin. This is similar to standing orders for diabetics. It's used for those clients whose blood sugars are less stable. An extra dose of insulin is given when the blood sugar is above a certain range. Usually that range is 151 to 200. The higher the blood sugar, the more units of insulin may be given. At a certain high blood glucose level, an order will be given for X amount of units of insulin and to call the physician immediately. The client must have a doctor's order for sliding scale insulin. The best practice is to have one set of sliding scale orders for all clients in a facility who require extra doses. The potential for errors is less if the staff is following one set of guidelines. However, for clients in their own home, there will still be sliding scale orders for that client only. Be sure to check your client's medication administration record or check with your supervisor so you don't assume that there is a standardized protocol where you work. Now we get to the fun part, giving an injection. Insulin syringes have a very short, thin barrel and needle and can contain up. Let's take a closer look at the tip of the needle. We call this angled area the bevel of the needle. It is cut at an angle, allowing the smallest part of the needle to enter the injection site first to minimize the pain. When giving an injection, the bevel of the needle is always facing up as it enters the skin. Let's take a look at the layers of the skin. The uppermost part of your skin layer is called the epidermis. Here is a diagram of the various sites on the body where a subcutaneous injection can be given. They may be given in the arms, legs, back area, and abdomen. If they are given in the abdomen, make sure that you are at least an inch away from the navel. You want to choose a site that is not reddened or bruised, and you should rotate sites after each injection. Before bringing the syringe with insulin or the insulin pen to the client, you must verify the first 5 rights of medication safety. Then bring all the supplies you'll need to the client. The supplies include gloves, alcohol wipes, a sharps container, and a syringe with the prescribed units of insulin or the prescribed insulin pen. Here now is the procedure for an insulin injection. You will have verified the first 5 rights of medication safety prior to coming to your client. Explain to the client what you're going to do. Arrange your supplies so everything is at hand: gloves, alcohol wipes, the syringe or pen of insulin, and a sharps container. Next, wash your hands and put on your gloves. Select the appropriate site or ask the client for a preferred site. Then pinch an inch of skin between your thumb and forefinger. Wipe the area with an alcohol wipe. Remove the cap from the syringe or the pen. Remember, the bevel of the needle is facing up. Insert at a 90-degree angle, that is straight in, with a quick thrust, kind of like throwing a dart. Be sure the needle goes all the way through the skin. You don't want to have to push the needle in. That is painful. If the client is thin, you may have to inject the needle at a 45-degree angle. Then release the skin and push the plunger slowly and steadily until all the insulin is in. Hold the syringe in place for 5 to 10 seconds. Then remove the needle at the same angle as it went in. Do not recap the needle. Place immediately into the sharps container. Remove your gloves, wash your hands, document administration and injection site. One more note. In the video you just viewed, regular insulin was used. This is a clear solution. Best practice is to roll the syringe between the palms of the hands. Different types of insulin may be cloudy. Rolling the syringe will thoroughly mix the insulin before administration. Another advantage to rolling the syringe between the palms of the hands is that the insulin will be slightly warmed for the client's comfort. The future may be now. What I mean by this is that laws and company policies and procedures once allowed only nurses to draw up doses of insulin or dial the correct dose on an insulin pen. Once that was done, you, the unlicensed person, could, with proper training and supervision, be delegated to inject the insulin. Times are changing, and some states have new, broader laws that allows nurses to delegate the drawing up and dialing doses of insulin. The nurse has the final authority and responsibility to use his or her best judgment as to the competency of the unlicensed personnel, the complexity of the task, the condition or stability of the client, and the degree of supervision needed to ensure safe performance of the delegated task. Just because the nurse has the authority to delegate the skill does not mean she will exercise that authority. She must always use her best judgment, coupled with proper training, competency testing, and supervision of her staff, to determine who she will have complete confidence in to perform this skill. If your company is now in the future, your nurses have the responsibility to train you in the technique of safely drawing up insulin from a vial, combining insulin from 2 vials for a single injection, and dialing the correct dose on an insulin pen. After satisfactorily completing the assessment for this module, you'll have an opportunity to practice the steps in safely administering a subcutaneous insulin injection. I know you will take this responsibility seriously and warrant the confidence your nurse has placed in your ability to perform this skill. If you have any questions about the rationale or steps in performing the administration of insulin, be sure you get the answers you need. Now, when you are ready, you may take the assessment.